I sponsored a bill on this. I know Representative Bowden sponsored a bill on this as well. We ultimately were able to get this bill through Health and Human Services, and we got it through committee with some level of bipartisan support. We also, with the bill that we currently had that made it through, we also had the nursing homes on board for the very first time. This has been a contentious issue far before I was there. The primary concern seemed to be that a privacy issue for individuals. I think that the bill that is written now, we put the onus on the individuals or their families to actually supply the cameras. There's a provision in place that if the cameras would be turned off in terms of when they're getting bathed or whatever, take care of that privacy issue. Also, if they have a roommate, that we've addressed that the roommate will either sign on and be aware that they're being filmed. I think it's a great piece of legislation. Again, I sponsored the bill. And this is not only for our elderly community, this is also for, we have a lot of disabled individuals in this state, that either with physical or certainly intellectual disabilities, that have no ability to speak up for themselves. And we need to have some provisions in place to provide protections for them, because we know there is some level of neglect that's taking place. I'm certainly not trying to vilify our nursing homes. I think they do a great job, and honestly, we don't do nearly enough to give them what they need. We need to probably raise the per diem rates. I mean, last year, I think I said it here in this forum, we lost 26 skilled nursing facilities in elderly care facilities. We are heading towards an absolute epidemic. I mean, especially as our population continues to age, we are going to have a huge bed shortage. So we've got to do more funding for this, but for this particular issue and for the bill that we have in place, we finally got the nursing homes on board. It's a good piece of legislation that would provide some level of protections for the most vulnerable in our societies and try to limit any neglect or abuse that would take place to individuals with disabilities, or particularly the elderly community. So I would love to see that through. I do not control, Representative Winchell is not here, I do not control what bills ultimately get a full floor vote, but I'm in full support of it.
I would just echo Josh's comments. They've done some work. It's certainly something we should be taking a look at. I would add two things. One, the comments about nursing homes and the funding and so on is true. It's a very difficult industry to be in right now. We did increase funding for nursing homes last year, if I recall, about $15 million for per diem. So we need to continue to look at that and how we can make sure those homes can stay viable. The other thing, and this is one of the disappointing things that didn't pass through, the House did pass a bill. You have these temporary staffing agencies out there that are charging or hiring people to go to work at hospitals and so on, and paying them a great deal of money. My wife's a nurse at Jenny Ed, and the traveling nurses and so on are making a lot of money. The House passed a bill that would have capped those temporary staffing agencies at being able to pay those workers 150% of what the average salary is, because that is just devastating to nursing homes, which are not capable of paying to get the staff in they need, and they're all going to the hospitals through these agencies. And so one thing we did do that the Senate didn't take up was to limit that to 150% of the salary, which should have been, would help the nursing home industry if we could have got that passed. So